right, wonderful. So I'd like to begin here. I just want to say hello and welcome from Vancouver Career College. My name is David. I'm the Regional Program Coordinator for the RMT program. I want to say thank you all for joining us and your time this evening to be here with us, as well as your interest in the RMT program. So some of the topics we're going to cover tonight are going to include what is registered massage therapy, or RMT? Why is RMT a high demand career here in British Columbia, actually, as well as across Canada? Building a career that works for you specifically in your lifestyle, the education and licensing path here in British Columbia to become a massage therapist, what an employer or a patient might expect or look for in their own RMT, what a typical day might look like as an RMT, why choose Vancouver Career College as your college to become licensed, about the RMT program that we offer specifically, as well as meeting our alumni and their success story tonight, which is fantastic. Some of the admissions, the work experience, and clinical requirements that are needed to get through the program, as well as some career opportunities and outcomes that we see in the career. So I'd like to also introduce some of our speakers tonight. We have Prab, who is one of our academic coordinators. We have Harleen, who is one of our admission representatives. We also have Shelley, who is our regional coordinator for career services. And we're fortunate to be able to be joined by one of our graduates and RMT's Elma this evening, who is going to share her experience through the program at VACC. At the end of the presentation, we will have time for some questions. So please, if you do have any questions in the meantime, feel free to find that chat button at the bottom of your screen. The little chat bar on the right should pop up, and just please at any time type in some questions there, and we promise to get to them towards the end of the presentation. Prab, the floor is yours. Please take it away.
Fantastic. Thank you very much, David. As David has mentioned, hello everybody. My name is Prab. Good evening, and thank you so much for joining us tonight. Here to talk to you a little bit, first and foremost, about RMT in itself and what it's like to be a registered massage therapist. First and foremost, you're a licensed, respected, regulated healthcare professional. What that means is that you have all the tools in the toolbox that you may need to perform at your very utmost best, because everything is going to be evidence-based. What this also does is provide a whole lot of trust in you as a healthcare professional, which is what differs you from someone, let's say, who may just be a body worker. So by having these skills and by going through this program, which is fully accredited and registered, you will learn evidence-based techniques, such as therapeutic massage, joint mobilizations, rehabilitative exercises, and everything that you can then apply in the real world for situations such as assessing and treating muscles, joints, tendons, ligaments in order to reduce pain and improve mobility in everyday life. Now, RMTs, they help a variety of patients, people dealing with stress, chronic injuries, pathologies, ailments, or just overall wellness. In terms of it being a high demand career, David is absolutely correct. It very much is. There's quite a few numbers of reasons for this, to be honest. The aging population is one of them for sure. So we have an aging population currently who we like to call our baby boomers. These are those individuals who are currently between the ages of 64 and 80 years old. As we age, we understand ailments and pathologies do come. And so this is one of the reasons why it's such in high demand. Also, regardless of age, we all deal with different issues and problems such as stress-related conditions, chronic pain, or many other things. Another big reason RMT is in high demand currently is for the fact that it is a natural healthcare option. Currently, we see this all the time, whether in magazines, in print, in the newspaper, on social media. Natural is the new medicine, right? People want to do whatever they can to be as healthy as possible. And a lot of the times that means being natural and taking for those options. Also, you do have the benefit of being covered under an extended health insurance plan. Many other healthcare professionals, such as kinesiologists, they are not granted this opportunity. And so by having this, you'll have many more patients because they will not have to pay out of pocket. They'll be assisted through their insurance plan. A few other benefits: high employability after graduation, very strong earning potentials, flexible career opportunities, and the ability to directly improve health and the quality of someone's life, which is one of the most important parts about the job and one of the most rewarding, to be completely honest. I'll be speaking of each of these in just a moment. So here it is. So in terms of how this career could work and why it may work for you, first and foremost, typical income. As you can see, even as a first year RMT, a new grad, you'll be making anywhere from $70,000 to over $110,000 annually. Now, this very much differs. It differs whether you're working in whatever city you are in, if you're in the clinic, whether you're in a spa, all these different type of situations do vary, but the pay rate is incredible. Very strong demand due to that consistent client flow and income stability, which then leads us to a flexible schedule. I think one of the most amazing parts of being an RMT is the ability to set your own schedule. Because the career is in so much demand and because you'll always have patients coming through the door, you have the ability to have a fantastic work-life balance, which is obviously very important to all of us. So you get to pick the days you want to work and when you don't. In terms of the licensing path and some of the education requirements, first and foremost, you need to be registered with a fully accredited program, something such as ours. Now, why do I say that? By being fully accredited, we have 3 years of accreditation, which gives you, a new grad, the ability to go ahead and write your licensing exams with absolutely any interruption or any delay. Schools which do not have this full accreditation, students are not able to write their licensing exam right away. They must instead go through further processing and further steps. So this is a huge benefit of joining VACC. You get 2 years of study, which falls at about 2,700 hours, both in person and all in person rather, but some in clinic and some in the classroom. Once that education is complete, you'll be applying for said licensing exams. These licensing exams are governed by the CCHPBC, who's the College of Complementary Health Professionals of British Columbia. Once you go ahead and pass these board exams, you can go ahead and get registered and fully licensed. And then you're on your way. You're on your way to being a successful RMT with all the tools you need. A little bit about what makes an RMT an amazing RMT. What do we strive for in our graduates? Well, when we set the standard, we set it extremely high. And so we know that employers and patients look for many things, namely confidence in your hands-on skills, right? So your ability to assess, treat, and adapt to each and every single client. Every situation that you come across will be different, and you'll need to know the skills and the techniques needed to deal with every single one of these caseloads. And here at VACC, we do just that. We provide tons and tons of hands-on skills, so you're very confident in your practice. You'll get a strong clinical understanding that comes from our ability to give you that strong knowledge base, but also because you'll be in a clinic setting as early as term 3 out of 8. So it's very important that you understand exactly what is needed for each treatment, which you'll learn here. Clear communication and empathy, professionalism and reliability. So we're making our clients feel safe, heard, and understood. And we're doing that by showing up consistently and building that trust, which is going to then go ahead and give us good client retention, right? Turning those first initial appointments into subsequent appointments, which is, of course, very important as an RMT. All things that we very much try our best to teach here in the program. Now, what I'm going to go ahead and do is just pass it on over to David once more, who will take you through a couple of things of a typical day in the life.
So as Prabh said, typical day for an RMT. As an RMT myself, some of the things that we do is we do conduct client assessments. We create treatment plans for the patients just based on what we think clinically and what the patient is coming into our treatment rooms for. We provide a lot of hands-on therapy for pain relief, recovery, wellness, and anything else the patient might want help with. We maintain our treatment notes and we monitor client progress as healthcare professionals. We manage our flexible schedules and our growing client demand. So we may have times where we're very busy and maybe we work at 2 clinics to increase our ability to treat more people. We also always have ongoing learning and growth within our practice. That's why we call it a practice, is we're always learning new things within the industry. So even outside of school, we continue to be interested in what the newest, latest, and greatest information is. Now, in regard to where you'd like to work, if you work in a clinic, you get to collaborate with other healthcare professionals such as physios, chiropractors, naturopaths, as well as you get the perks of having a front desk or a clinic staff that will do all of your bookings and billings for you for the most part, which is really, really nice when you just want to get up and leave your workday and not have to deal with any residual booking and billing. You also have more of a structured environment with a steady client flow. So if you have a cancellation, last minute cancellation, sometimes the clinic is able to just book in a patient for you with a big list of patients that are waiting to see people. On the other hand, when you work from home, you get a lot of flexibility within your hours, your rates, and your availability, as you could work 7 days a week if you really wanted to. Or you could work 3 days a week if you wanted to and just do more long days because your home is where your practice is and you get to do what you want with your time there. You also have to handle your own marketing, your own bookings, your own business operations. As massage therapists, we don't really have to market ourselves a tremendous amount. So once your practice starts to get going, that ball is just rolling, and for the most part, you are just sustaining that practice and again, making patients happy. You also have greater independence and income flexibility, as I was mentioning, with your hours and your rates and your availability. You are your own boss in both settings. So it is a great career as an RMT. You wake up pretty happy every day to go to work. And back to you, Prab.
Thank you very much, David. So we did touch on this a little bit, but we're going to go ahead and get into this in a little bit more depth. The RMT program here in VACC. So the duration, as mentioned, is 88 weeks. Now, this is over 8 terms, which are about 11 weeks in length, which gives us our 88 weeks. We do have 8 terms, and as mentioned, as early as term 3, you will begin working with the public in a clinic setting. By having all that total training, you'll graduate with 2,751 hours of combined classroom and practical learning, which is a ton, which is meant to prepare you and make you the best RMT possible as soon as you graduate. In-person learning, the biggest thing here, this is a practical program. It is absolutely impossible to learn something hands-on virtually. It just can't be done. You need to be in the classroom, experience it hands-on, watch demos, and get your practice in. So that's where we pride ourselves. And that takes us to our clinical practice. You get that 550 or over 550 hours of real life clinical experience dealing with the public very early on in the program. So by the time you graduated, you're ready to go, you feel confident, and there's very much nothing missing. We do have transferable credits. So we do have a program at Thompson Rivers University. If you perhaps would like to continue your education, perhaps get into a different field or a healthcare related field, you are more than able to do that. And as mentioned, fully accredited. Now, we are fully accredited by the Canadian Massage Therapy Council for accreditation. And what this means, like I mentioned, is very important. It gives you the ability as a graduate to write your licensing exam right away, as soon as it's made available to you. If you don't go to an institute, which is fully accredited, which some are not, you will have to have a wait period as well as complete additional steps before you can write your licensing exam, because the CCHPBC, they're not all that happy with that institute. And so they want to make sure you really are as good as they say you are. Whereas here, that problem does not exist because we're fully accredited. And as soon as you graduate, you're able to write your boards. Now, in my experience, this is what students prefer. You're in this program for 88 weeks. They can't wait to start their actual practice and start going and make that money. So this is a huge benefit. Lastly, an established program offered over at 2 campuses, both Burnaby and in the Fraser Valley there in Abbotsford, both very strong reputations and great support systems, regardless of where you decide to come. And now a little bit further on, what makes us special and what makes us the institute of your choosing? It's that hands-on clinical training. Real world massage techniques are taught to you as early as day 1 in term 1. So you're very, very confident by the time you graduate. You get different experiences which are meant to cater towards your learning and make it even that much better. An example is our optional cadaver lab experience, which very much enhances your understanding of the human body and anatomy, because it's a real world deep dive, quite literally, into a cadaver. So you get to very much see muscle tissue, fascia, tendons, ligaments, all these structures that you're working on day to day. That takes me to a very strong medical knowledge. If you're looking at these type of tissues and different type of structures, of course, it's important that we have the knowledge base and we become well rehearsed in it so we can understand and then utilize that knowledge. So things like anatomy, physiology, pathology, all this goes hand in hand in treatment planning, as well as having evidence-based treatment techniques. We are career focused and we are industry designed. You're soon going to meet Shelly, who's going to tell you more about that. But our program is very much built with industry input in mind. We are preparing you from day one to enter the workplace right away and be a respectful healthcare professional, right? Which takes us to that professional and business skills. Some of us may want to work in a spa, some may want to work in a clinic, some may want to open up our own clinic. So, regardless of what you'd like to do, you will be very well prepared by the time you graduate. We have classes within the program that are designed just for this reason, to show you what does it take to open up a clinic, what are the costs, what are the needs, what are the requirements. Everything is set out for you so you're well prepared, regardless of which path you choose. And then lastly, as mentioned, we are certified and regulated, right? So by the PTRIU, we are approved education. So all of our program, all of our curriculum, everything we teach you is evidence-based and approved. We've gotten the gold seal of approval, which gives us the ability to prepare you as best as possible for these licensing exams. And hence why being fully accredited, that is a huge deal. So when it does come time for those licensing exams, just to mention, we do offer further support in term 7 and 8, as well as in the remainder of the program or the rest of the program. We do offer classes which are designed as strictly almost review for these board exams. So you'll be very well prepared, and that is why you should choose us. And what I'd like to go ahead and do now is just pass it on over to Elma, who's going to be speaking to you a little bit about her experiences. Thank you.
Hey everyone, this is Elma. I just didn't expect to see me and the panda on the slides. So I graduated from BACC since 2018. So I've become an RMT for years, 8 now. So it's honestly a little bit unreal for me to be here and speaking, because not too long ago I was just stating I was sitting in a classroom and I was same as everyone right now, trying to figure out what I wanted to do in my life, wondering if RMT was the right program for me, and honestly wondering if I can actually make it through the program. So today I'm not here to give you a textbook speech. I just wanted to share my real life experience, my journey from a student to a practitioner, an RMT to a clinic owner, and hopefully give you a more realistic picture of what this profession can become. So just a little bit about myself, my background. Before becoming an RMT, I was practicing as an acupuncturist and I had a panda clinic since then. So at that time, I loved what I was doing, but I just want to put more tools into my toolbox. I just want to learn something different. I wanted to learn human body from a different perspective. Just wanted to understand it from a different angle. So as an acupuncturist, I often talk about acupoints, meridians, yin and yang, and sometimes I feel this concept only makes sense to someone who has an Asian or Chinese background. So I realized I wanted to a lot of people, they understand muscles, joint posture, movement more than the traditional Chinese medicine. So I just want to learn a new language, a new medical terminology, which can better deliver and help with my patient. So for me, learning RMT was not about replacing the acupuncture. It was about becoming a more complete practitioner. So I wanted to understand anatomy, physiology, and how body function at a deeper level, and this is exactly what I got from the RMT program. So the decision I made in 2016 changed the way I practice till today. So one thing I loved about being an RMT is how immediate the impact can be. So you will see someone can walk into your treatment room, feel stressed, tired, overwhelming, in pain, or feeling disconnected from their body. But after one session, from the therapeutic touch, from the communication, from your caring, sometimes you can generally make their day better. So, and this feeling never gets old. But the other thing I will be honest with you is school wasn't easy. There were definitely some moments I feel overwhelmed. That's going to be a lot of stuff to learn: anatomy, pathology, orthopedic testing, treatment planning, outreach clinics, school clinics, mock OPs, board exam. It's a lot of things to study. Sometimes you feel your brain is full of those information. I still remember on day one, I was like, how am I supposed to remember all of this? But at that time, we were only learning bony landmarks. But looking back now, I realized the program was built a foundation, especially at VACC. After I graduated and seeing different RMTs from different schools, graduate from different schools, I do notice VACC actually covers a lot of the programs or objects which other schools doesn't cover. But that one gave me a very valuable practice foundation because I know a lot of the schools they don't cover, excuse me, pregnancy massage, and I was actually very surprised to see so. So looking back now, I feel like learning at VACC not just for passing the exam, it's for becoming a healthcare professional. There's one thing I want to tell everyone considering this profession is you do not to feel like you're ready right away. You do not to feel like, oh, I'm not confident to become an RMT because I feel confidence comes from experience. Confidence comes from treating patients. Confidence comes from making mistake, learning, improving, and repeating this time over and over time again. So today in my clinic, Panda Clinic, we have it's a multidisciplinary clinic. We have RMTs, chiropractors, physio, acu, naturopath doctors, all healthcare professionals working together. And this is also, I feel this is the beauty of RMT program because you get really into the environment that you never stop learning. So one day you are just treating a shoulder injury and you will discuss the rehab exercise with a physiotherapist. The other day you are learning movement mechanism from a chiropractor. You're constantly grow and being around with different healthcare professions. As an RMT, after you graduate, you get to work into different settings of workplace. You can work at sports clinic, you can work at the physiotherapy clinic, you can work at a spa, you can run your own practice. This also give you a different focus of your modalities. You can focus on if you love sports, you can work with sports injuries. If you love a rehab, you can work at the ICBC focus the clinic, working a lot of post vehicle accident clients. You can enjoy if you do enjoy prenatal treatment, and you can choose like your different focus of your RMT. So there's no single correct version of being an RMT. You can design the way you want to be. You can develop your own passion about treating different kinds of audience. This is also the best part of the profession. You can build a career around your personality and around your interests. For me personally, becoming an RMT also helped me to become a better communicator and a business owner. So I learned a lot how to listen to people with patience and build up trust and explain complicated things in a simple way. So this is not just clinical skills, it's more like a life skills. So if I ever want to give like a few pieces of advice for future RMTs, future students, so what the first thing I feel is school can be complicated, study can be hard, especially we're all adults. Probably a lot of us has been not sitting in a classroom for a long time. The first thing is don't compare yourself too much. Don't give yourself too much stress because you will see some classmates, they are smarter than you. You will see someone, they are more confident than you. They will see someone learning techniques faster than you. Because when I was in school, I struggled a lot, like for pregnancy, treating pregnancy women, and in terms of draping. I don't know how to do a satellite draping. But the thing is, it doesn't mean you cannot become a good practitioner. As long as you practice, I think passionate towards this profession is more important than how fast you are learning things. People who usually succeed long term are the ones who can stay consistent, stay curious, and stay caring about people. And the second thing is communication matters a lot. Patients coming to your door, they're probably in pain, they're not having the best in their life. So you want to listen to them, you want to feel what they feel, you want to explain things clearly, you want to show your care. And the last thing is stay open-minded because there are going to be a lot you can learn, and the more you practice, you feel the more stuff you don't know. So stay learning, stay open-minded in terms of different continuing educations, and build up your interest and build up your passion towards this profession. I feel like you don't have to have your future. Your future is not like becoming RMT, your future is set. You can still have different angles after you become an RMT. Um, at the end, I feel like honestly becoming RMT, it changed my career, changed my life. Um, I really love like I can help people directly and I can use my continual learning knowledge to apply on my current patient. And at least I feel like I'm doing something meaningful. I still feel rewarding after 8 years practicing as an RMT. So that's my journey, and thanks for listening. I'll be happy to answer some questions afterwards.
Thank you so much, Alma. That's an amazing story. Thank you. We appreciate that. My name is Harleen Mangat. I'm Assistant Director of Admissions at Vancouver Career College. I will go over entrance requirements for the program. So first requirement is high school diploma. This is needed if you are 18 or younger. But if you are 19 or older, you will qualify as mature student status. Other than that, we will need your, we have a massage workshop that is conducted on campus. We send students who we know are serious about the program, they are passionate about it, they are good fit. We enroll them into this workshop. This is free of cost, but this is like a mini trial to your clinicals. Other than that, we will set up an interview with program coordinators. This is again since it's an intense program, we want to make sure that it's a good match for you as student and for your instructor to guess that is this the program that aligns with your goals or not. Other than that, there are some work experience requirements. These will be needed when you go for clinicals. So first one is your standard first aid CPR, your criminal record check, and immunization form. Now, college will guide you with all the process. Once you proceed ahead with your application, we will guide you into these. And other than that, we have upcoming start dates for June and July for our Vancouver Career College, Abbotsford, and Burnaby locations. And we have some amazing scholarships. So yeah, let us know if any of you are interested. We can do it case by case basis as well. Now, I would like to pass it on to Shelley.
Thank you, Harleen. So I am the Regional Career Services Manager for our BC campuses. My team provides career services supports for all of our grads for up to 6 months after they graduate. So once you're licensed and ready to go, we are there to help you connect with clinics and employers all around BC to help you find RMT work once you're graduated. The nice thing is our RMTs usually get hired pretty quickly. You can almost choose where you want to go because they're in such demand. It's been mentioned previously, there's so many opportunities and paths that you can take as an RMT. You can work in a clinic or be like Elma and open your own. You can join multidisciplinary clinics where you're learning from physios and chiros and naturopathic doctors and getting to blend services to support your clientele as thoroughly as possible. Cruise ships, sports teams, these are options for RMTs. Home-based clinics, or perhaps you want to hit the road and create a mobile service where you are traveling to your clientele. There's so many different flexible options. The really cool thing, like it's been mentioned before, is that you can actually take this foundational knowledge that you have learned as an RMT, and you can actually continue on to other healthcare programs like physiotherapy or chiropractic medicine. The other really cool thing about being an RMT is the flexibility of scheduling. We get all sorts of folks coming into the program from all different walks of life. Some people are ready to dive in head first and become a full-time RMT. Others have other education they want to pursue and complete, or perhaps they have childcare, situations that need to work around. As an RMT, you choose how much or how little you are available to work and set your schedule around that. So it's quite nice. In BC, there are a projected 3,700 or more job openings in RMT between 2025 and 2035. This is based on BC's labor market outlook. And it is predicted that about half of these openings will be due to new roles and positions being created, and about half of them will be because of folks retiring and leaving the field. Our own Vancouver Career College RMT graduates have an employment rate of over 90% in the past 5 years. So that's over 270 grads in BC that are working in the RMT field that have come from Vancouver Career College. If you go on to any of the job search engines, Canada Job Bank, Indeed, all of these are going to have recent RMT postings up on their site. And you'll see opportunities ranging from $110 an hour to $140 an hour, upwards of $150,000 a year, depending on your availability and how much you're wanting to work. So there's potential to go a couple different routes there and have full-time or part-time hours. Clinic owners and healthcare employers are regularly reaching out to myself and my career services team asking, when's your next batch coming out? We're looking for RMTs. Clinic owners and managers like Alma value what our grads bring to the table because of the wide variety of training and experiences that they get. If you have a look on your screen, just in the last little while, these are some of the companies that are reaching out to us. They want to know when our students are getting registered, and they are, not even posting job postings. They're reaching out to us directly. Allied Physiotherapy, Synergy Rehab, all of these companies are wanting to hire our students.
Thank you, Shelley. And thank you to everyone who has been speaking tonight. And Elma, our guest speaker, thank you for being here with us. And thank you to everybody for sitting through our presentation. We are at the point in our presentation where we'd love to open up the floor to questions, whether that's new questions, something we haven't touched on yet, maybe something that we just want to clarify that you are still wondering about, or something that we can elaborate on while you're here in our open dialogue. So if you can just type your questions into the chat itself, and I will be able to direct them to who might be able to answer your question the best. You can go ahead and do that now. So there's a question for you there, Harleen. I can just let you read it, or if you want to read it out loud, just for everyone to hear.
Yeah, I got that. So does your school accept English test results over 2 years old, such as CELPIP and IELTS, or is it necessary to be within 2 years? Beyond 2 years typically means it's an expired test. So unfortunately, we don't accept that. But if you're passed then, you will pass now, right? Because language improves over time. So, and there are some alternative pathways too. So yeah, let us know like what you have completed so far. Maybe if you have Canadian education, we can look into that. Maybe you don't even need CELPIP or IELTS. Thank you. So I think second question is for Prab, or David, do you want to take that?
Probably deal with a lot of the scheduling and things like that if you want to touch on that.
Absolutely, but do you just mind sharing the question? I can't see it for some odd reason.
It says how many hours of in-class training every day? So kind of like when you show up to school, what your day would look like.
Fantastic question. Great question to whoever asked that. So a normal typical day is going to be from about 9 a.m. to about 12 p.m. You'll have about a half an hour lunch break, and then you'll go ahead and continue on from about 12:30 to 3:30. Now that's usually our first option. It'll be one or the other. Now that, why I say, is because we have two different type of classes in this program. We have those which are academic in nature, and we have those which are practical in nature. So our academic classes, those run for 3 hours. And so let's say we have two academic classes back to back, which sometimes you get paired like that, then you'll be from 9 a.m. to 3:30 p.m. If, however, you have a practical class, they run 3.5 hours in length. So 3.5 plus 3.5, 7, of course. And so that would be a day which ends at 4:30 p.m. So 9 a.m. to 4:30 p.m. or 9 a.m. to about 3:30 p.m. and very, very rarely, not too much later. In case you need any further clarification, just please ask. But I hope that answered your question.
We did kind of have a follow-up question to that. Is it online or is it in class? Most of our or all of our current classes are in person. As Prabh had mentioned earlier, some of these practical components of learning to become a massage therapist just simply cannot be done online. However, we are kind of going down the road of being able to offer some classes online in the future, because we do realize the benefits to that as well. There is a question, can I take a break in between the program for personal reasons? There is an allowable break. Of course, people on student loans, there may be a limitation within that. So anything beyond a 2-week period or a 10-day period, I think it is, that you would no longer be eligible for your student loan. So that might be something to consider. However, depending on the personal reason, of course, if it's just you want to take a vacation to Mexico, we probably sit down and have a little chat. But if there is things, we know that people do go through things in life, and things happen. So we would try to manage what that break would look like for you and how we could best come across where you could continue in the program. If there is to the point where you need to take an entire term off, we do allow you to return as well. And Elma, there is, what would you look for in an RMT that you're looking to hire?
So for me, I'm looking for someone who is actually passionate about what they're doing, caring about their patient, whoever going to be on their table. The reason why is I feel massage technique itself is very subjective. Doesn't matter how long you're practicing this field, there's going to be someone like your hands-on skills. There's going to be someone doesn't like your hands-on skills. But no one will say no to caring. So being able to give your knowledge to someone who is on your table, and being able to show your care and your professionalism, and this is number one thing I'm looking for if I ever want to hire RMT.
Wonderful. Is there an age limit for this career? Is that, Elma, do you want to just jump on that one as well?
Nope.
Yeah, we do have students who come in here after multiple career changes. It just really depends on how well you take care of yourself. If you are somebody who, gets good sleep, you can manage your stress properly. Again, you set your own hours, right? So if you do feel like the job is taking a toll on you, you can still engage in other hobbies and other jobs part-time, as well as work as a massage therapist, depending on your situation. We have, do I need to get all of the different kinds of vaccines? So in regard to our vaccination requirements, a lot of it has to do with coming back to protecting the public, because we are a healthcare service. So as a massage therapist ourselves, we are subject to being told that we may or may not need to get specific vaccines, depending on when that discussion happens between the government and our licensing body. So for the sake of entrance requirements, you don't need to have the vaccinations to enter. However, we do ask that people disclose their vaccination status as they enter the clinic and treat the public, just in the case that there is an outbreak of an infection and we need to be able to control and contact the right people. So somebody who is unvaccinated, we may need to have them stay away for a little bit longer. But we've never really run into outbreaks of infections, fortunately. So that hasn't really been something that has been a big major issue for us. Sorry.
I would like to add one more point. Like if you got vaccinated in Philippines, let's just say that, typically doctor just prescribes a test. Like if you have a family doctor, even walk-in clinics, they could prescribe the test for you, which could cover all of the, immunization records. So that's not a very difficult process. That can be done very easily if you got immunized in Philippines as well.
Yes, thank you, Harleen. Do you have a student massage clinic? Yes, we are very fortunate to have a student massage clinic right on campus. Abbotsford being our newer location, we have a brand new, beautiful clinic over there. We also are able to accommodate twice as many students at our Burnaby campus because we actually have a secondary clinic on site as well. So that gets pretty fully loaded with patients when we have the days of the clinic is open. So can we work side by side during the course? I'm not sure, Ankush, exactly what you're asking. If you could just restate that question, or if anyone.
I think he's meaning, like, is it possible to work while also taking the program?
Oh,
and
I get
so
you. I get you.
This is one that actually is a question that comes to me in career services quite a bit from students who are currently in the program. School is expensive, and they, want to get a little bit of that, side income happening. And so usually my advice is get settled into the program. Don't plan on working to start. Figure out what that workload is going to look like for you. Figure out how you're going to cope with that workload and the study and the homework and whatnot. And then at that point, decide if that's something that would fit for you. We do have folks who have part-time work on, evenings or maybe on the weekends now and then, just to supplement things a little bit. But it can be a lot for some. So you definitely give yourself at least a full term to see how things are going, and then make the decision at that point if adding any additional hours is good for you.
Mm-hmm. Perfect. Is entry into the program very competitive? I've read a biology prep course is advantageous. Of course, we only have so many seats within our classrooms, but we can accommodate quite a few students. So usually we do have a couple extra spaces for people who pop in last minute. So even if the date of the next term has started or is very, very close to starting, still try to get into the date that maybe works best for you. If that is a sooner date, then still we may be able to squeeze you in as well. As far as the biology course, that is more of course, any extracurricular learning is going to be advantageous in your career. As I was mentioning earlier, we do call it a practice. So anything that you can read or get your hands on, or just prepare yourself a little bit to whether it's just terminology, just the sitting down and reading habits, things like that might be very beneficial for some people. Kevin's asking, any info on student loans? Harley.
I'll take one. Yeah. So yes, our program is eligible for student loans. We have very good standing with student aid, so absolutely we can help you with that. Now, how much funding you're going to get approved, loans and grants, that all is very case by case basis, individual basis, depends a lot on your income, your situation. So absolutely, we can help you with that. I would say if you are already in touch with any admissions advisor, get in contact with them. If not, leave your information here and we can definitely set up a one-on-one call with you to give you more details.
Wonderful. And just kind of along the same lines, another question, am I able to begin the application process on the website?
Well, since there are a couple of prereqs for the program, it is a little challenging to coordinate all of that on website. You will need one of us, admissions advisor. So we are here. Let us know and we'll walk you through the process. We'll make it more easier. Yeah, I think that would be the best case. If you're already in touch with someone, reach out to them. If not, leave your information here. And because, we'll need to book your interview, your workshop, we'll need to check on your language requirement, whether you have high school or not. So all of that needs some back and forth, some paperwork. So you will need an admissions person. It's tough to do on website.
Thanks, Harleen. Next one is, I'm planning to do RMT next year. Is there anything I need to work on? Any studies or recommendations so I can clear my basics in free time? Please guide me on what to do. So, of course, if you don't have a background in anatomy and physiology, neurology, or anything healthcare related or massage therapy related, of course, any readings is going to be a good thing. You can even go directly onto the CCHP-BC website, who is the one who gives RMTs their licenses. This is the same college that gives you the board exams. They have a list of books on there that they recommend for students who are taking the board exam. So all of those books are pretty much the ones that we utilize in our program as well. So those would be a good one to take a gander if you have access to some of those. as well as there are really fun YouTube channels like Crash Course that can kind of guide you into fun animations on, blood flow or learning about different things within anatomy that doesn't make it so dreadful to open up a textbook that has 400 pages. So little things like that, you can find little solutions on YouTube. But as far as specific things we need you to know before you get into the program, no, there's going to be, you can come in here and from day one, we will take you through the steps. We will support you along the way and make sure that you can get through the process even without any preparation. And if anyone wants to add tips to that, Elma, or
Oh, I can add a little bit. I don't think if you don't have time or if you feel a little bit overwhelming reading all those textbooks, don't worry too much about it. I think for term one, all the instructors, they are really good at taking class along with learnings. So it can be a little bit overwhelming at the very beginning, but it's only about memorization. You spend time on it, you will make it. So it's nothing too hard. It's just a little bit memorization at the very beginning. And with the school goals, it's a layer by layer and things start to make sense on you.
Thank you, Elma. I'll just go ahead and chime in on one thing. I completely agree with Elma as well as David. If there is anything that I see students struggling with when they come into the program early on is, like Elma mentioned, having to memorize everything. So it's going to be your job to try and remember muscles and landmarks and all these different things. In term one, when you first come in, if you'll be coming in quite soon and you plan on it, one thing I can recommend is perhaps you don't have to pay very much. You can go to the library, folks. Like David said, YouTube videos, there's very many. If you do, however, like to grab a resource for yourself, flashcards work absolutely fantastic. So anatomical flashcards. On one side, you got a muscle. On the other side, you got a couple of bits of information, what the muscle does, where it attaches onto the bone, things of that nature. Early on in the program, we start with our upper body and we actually start off with our head. So if you are serious on getting some good preparation in before entering the program, that's where I would begin. I'd start at the head and just work my way down. At least familiarize yourself with the names of the muscles, the names of our bones. Don't beat yourself up. That's, the program's going to teach you everything you need to know, but just become familiar. It'll very much help.
Awesome. Thank you, guys. Have you experienced any physical strain or long-term wear and tear from working as an RMT? I may pass this one to Elma. I'm 240 pounds. I'm 6'1". Pushing on people is quite easy for me. So I don't really feel any aches and pains. So I'd maybe, Elma, make your fingers take a little bit more toll.
I would say every single profession, you are going to have some occupational issues as well as RMT. I'm not going to lie. But the good thing is we have a better body awareness and we know how to rehab well. Don't use your thumb and you're going to be taught at school. So the thing is, as long as you have a good biomechanic and you're not overwork yourself and you take care of your body, you stay active, I don't see long-term wear and tears from working as an RMT. I'm year 8. My body is functioning pretty well.
Awesome. Yeah, I would say that what Elma was saying, the biomechanics, not using your thumbs or overusing your thumbs is actually part of the skills that we teach in the program. So that will be definitely part of the things and the tools that you learn, because we do want you not to just enter the workforce, but to also have a longevity in the workforce for sure. When would be the next opening?
I'll take that one. So we have 2 campuses. We have one in Abbotsford, another one in Burnaby. So we have upcoming start dates. For our Abbotsford one, we have June 1st. For our Burnaby one, we have June 22nd. We also have July 13th for Burnaby. Depends on which campus you want to go to. And I believe next one is also for me, how many intakes your school offers. It depends on from campus to campus. Let us know which campus you're looking for. There might be another start date end of the year. They might won't be, but we'll need to double check which campus you want to go to, Gagan. Let us know.
Awesome. Will you recommend, if it's okay, to work in other non-registered massage therapy clinics? Will that help? My experience is if you're going into a profession, you kind of want to align your hobbies, the people that you surround yourself with kind of the same mentality. Now, it's not like it's a bad thing. You can definitely go and get the experience and practice your communication, practice your hands-on skills for sure while you're getting paid, especially if that's the only place hiring body workers in your region. However, there are definitely options that we do have a job board at the school that people are looking for body workers. So there are definitely options that are from registered clinics. But people do build bad habits around things when they don't have the proper support, which is why we take pride in supporting our students when they're in the program. So if you are working outside and within a non-registered clinic, sometimes people may generate bad habits, which can definitely lead to a bad habit on a board exam or just in your private practice as well. So it is definitely up to you. We do not tell students what they can and cannot do outside of the school, but we just definitely give you that advice.
And I'll chime in there too and just say that, if that is something that you're interested in pursuing, that's where you'd connect with your career services team as well. And so, that's what we're there for in terms of helping you research possible roles for you and possible sources of income that way. So you're not doing it on your own.
Elma, I might pass this one to you just because you seem like you're a busy lady within the healthcare field and still working at your clinic, whereas I'm more at the school recently, so this doesn't apply to me currently. How many customers or patients per day do you feel comfortable treating?
I would say everyone is different, but when you're in term three, you will get into the school clinic. So at the school clinic, you will have a better sense about how many patients you can treat every day, and you still feel comfortable treating. So generally speaking, for a female therapist, we can treat 5 to 6 patients with a proper break. Having a break is really important. Having interval between each treatment is very important. Don't just go straight up like back to back treating all the patients. You're not going to treat as many patients as you're having a proper break in between. So I would say 5 to 6 is very comfortable. I do see someone treating 7 to 8. Don't overstress yourself, but you will have a better sense when you're in school clinic. And school will properly building up you on how to better use your bodies. And also, it will come to you as more you practice.
Yeah, awesome. And within the school clinics, you will treat upwards of a full schedule as 4 patients back to back. So realistically, once you get into your own practice as an RNT, you're only kind of bumping that up to 2 extra patients. Plus, you're going to get a break depending on how you want to schedule your break. So you could take an hour break, you could take a half an hour break, whatever that looks like to you. Do you need massage for yourself after work? I think everyone needs massage after work. But no, if you're feeling like you're run down and it's too much for you, you might be working too much, or like Elma said, you're not structuring your day enough. Personally, actually, when I got out of school, what I did was I worked Monday, Tuesday, I took Wednesday off, and then I worked Thursday and Friday. I did that for 2 years before I bumped my schedule up because you are making a good wage, and so therefore you don't need to work 8 hours a day, 5 days a week if you don't need to. So which is great. I already work in healthcare. In security, I'm confused what I should do, RMT or nursing. Sometimes I feel like I like both. I want to help the community and make a change by giving services. Please tell me so it can be clear. From my experience, I actually do see a lot of nursing students drop out and come into the massage program. As Prab was talking earlier, this is actually a really, really good springboard because of the knowledge base that you get to go into other therapies, as well as if you become a massage therapist, your schedule is so flexible that you can still enter other programs that you can support financially a little bit while being a massage therapist. this is a little bit definitely of a personal choice for yourself, Ankush. I don't want to tell you which direction to go. I think within the nursing, they're both intense courses. Of course, in massage therapy, we shouldn't be dealing with blood or needles or things like that, or screaming people. So I think on a day-to-day basis, I think the stress might be a little bit less within the massage therapy. And your flexibility for being your own boss is a lot greater within the massage world. So I'll leave that one with you. If anyone else has anything to add to that one.
I would like to add. So RMT and nursing both are amazing programs for healthcare, no doubts about that. And a lot of times students are confused. But what I have observed is it depends a lot on your, end goals. Like, do you want to open a business one day or not? Or are you okay working for somebody, right? So that's a big factor. Other than that, financials. That's another, like how much money you want to make. Obviously not $1 million. I'm not going to say that, but a lot depends on what your goals are. So this is again goal setting. So this should be done, I would say, sit with your admissions advisor based on your past, education, your experience. We'll be able to help you out to see which could be the best course for you.
I came in late. Could you let me know the price of this course, please?
Yes. So the cost of the program is $44,727. Now that is for both the years, 2 years, which includes your materials as well. Other than that, since you're here, you will save some money. You will. There are two things. So because you joined into today's event, you save $650 in admin fee. Other than that, there are scholarships depending on which campus you want to go to, ranging from $3,000 to $5,000. And yeah, we can help you with student aid funding as well.
Awesome. Lost my place in the chat here. Okay, are there any perks to attending the event just beyond getting some information?
So as I mentioned, financially, yes, you will save some money since you're here, and we appreciate you being here today. So $650 for admin fee, you will save on that one. And yeah, on to the next one. Maximum number of students you take per class. Do you want to answer that, David?
Awesome, thank you. If someone doesn't pass a course, is it possible to add it to the next term? Or does it need to be clear to start? Sorry, does it need to be clear that before starting the term, anyone doesn't pass a course? So basically, if you don't pass a course for whatever reason that might be, there are going to be a couple options. So we do definitely give some leeway. We know that every course isn't going to be everyone's strong suit. So there are supplemental exams that you can write, which allow you to retake an exam so that you can actually attempt to pass the course. The exam is going to be the same content, but we might have a scrambled mix of new questions within the same curriculum, in which case you can attempt that twice in a year. As well as there are repeats. So if you are out of supplemental exams, we call them, then you are able to also repeat courses a certain amount of times, so that it's not just, you fail a course and there's no more tries for you. We definitely know that there are going to be stronger courses for people and weaker courses for people. And so with that, a lot of people don't usually exhaust all of their options and have to drop out for those reasons as well. And if there are, it doesn't just come to the point where you end up failing a course. As Elma was saying, we do support you throughout the process. It's not just going to be a, better luck next time kind of course. It's going to be every time. For example, if you were to fail a quiz that's only out of 2%, we actually sit down and talk to you and have you sign a piece of paper that says, you failed this quiz. What was it that you failed the quiz by? Was it because that you don't understand the material? Is it just kind of a one-off thing? You didn't sleep well yesterday. And every time that happens with any type of assessment, whether it's a quiz or an exam, we sit down with you and we talk to you about options for moving forward, so that we don't have to get to the point where you exhaust any of these options of failing or anything like that. Hopefully that answered your question.
I think there is first part on a maximum number of students you can take per class. A typical class size is 42 students. Thank you.
Yes. If you see me fiddling around, it's because my computer might die, so I won't die yet, but soon. So Ankush wants to connect to an advisor. So I could say, Harleen, you did mention this already, but if anyone doesn't have an advisor currently, please leave your name and your email in the chat, and we will reach out to you directly and make sure that you get all the information moving forward as well. We will finish some more questions here. We still have a couple questions to go. So we'll finish off here. Are we paying for any supplies during the program or course fees, or do the course fees include everything?
Your tuition will include your materials that you will be using during clinicals. Sometimes students will need to spend some money on their massage table. That is an investment that you will have to make eventually as well. But while you're in school, we have beautiful clinics set up at both the locations, so you don't need to spend any more money. So that includes your materials.
And yes, and for the most part, you can probably find a massage table online for roughly $50, $60 that's used. Basically, what we use these for is the outreaches, which is later on in the course. But of course, if you don't have a massage table at home, it's going to be extremely hard to practice. I know some people try to use their mattress or something like that. But like I was mentioning earlier, if you're not kind of practicing the same way that you should be actually treating people, you can generate bad habits and things like that. So, but yeah, for the most part, pretty much everything that you are paying for is going to include everything that you need. Joyce just wanted clarification on the cost for the 2-year program.
The cost for 2 years is $44,727.
Perfect. And Joyce, if you didn't hear that, just please reach out again. Is there any particular reason why your college costs more than other private colleges with accreditation in Vancouver? Now, within the costs, a lot of the times our program is slightly longer. This is just to make sure that we can help with assisting anything along the way as we build a strong foundation. Because Elma was saying the program itself across Canada is very much the same program. I actually work for the accrediting body in order to prepare these programs for VACC. And the program itself, the expectations are the same nationally. So it's just depending on what the program wants to put into their program as far as what we want to give to the students. So we kind of go above and beyond with prepping the students and giving them the 8 terms where we have a full term of review before the board exam. So we take you through the whole mock oral practical exam, which is basically a harder version than the provincial exam, so that we can make sure that we can highlight any issues you have before you go to the board exam, because it actually is going to cost you more money if you go through the school, pay less money, get out sooner, you don't get as many skills within the program, and you fail your board exam. Now you're going to be wasting all of those wages you could have made within the last 6 months before writing your board exam, as well as having to repay the licensing fees, right? So there's a lot at stake when it's just like this program is more expensive than this program. It really ends up with, after 2 years, where are you going to be in this situation, or where are you going to be in this situation? Of course, there may be some students who can excel through a program by the skin of their teeth, but realistically, like I had mentioned a couple of times, it's a practice. So we really want to set you up for a long-term career that really benefits the public. And so this is kind of our approach to our programs. Perfect. I do see one last question here. Does it include any textbooks? Yes, every textbook that you will need will come within the program. These are going to be all e-textbooks, so digital textbooks. You can also find textbooks. There are some textbooks that are harder just because of the manufacturers just don't make them in hard copies, so it might be a little bit challenging to find some of them. But yes, you will get your textbooks for sure. And we'll finish here with Zaru. What's your board exam pass rate? So board exam passing rates are a little bit of a mixture of 3 different exams over 2 different times of the year, as well as some people do write it on the East Coast in Newfoundland. So depending on which exam you're talking about, but when I average all of the exams in accordance to the provincial average that CCHPBC lines up, we are never very far off from what they are, which just lets us know that what we're doing is okay. But another thing that we do is we take feedback from students. Being a private school, we can do this over public schools, is we can take feedback from students and actually apply it to our program a lot faster than a public school, because public schools are very contained within what they have to do. And I'm actually friends with the lady at Langara who runs Langara. And we were having this exact conversation a couple months ago where she feels like her hands are tied behind her back to not be able to make some awesome changes within the program. So we feel pretty awesome and honored to be able to take feedback from everybody who is in the program and adjust it for the future. So even some of your questions tonight, we can always take that into consideration and put forth some changes to make it better for you guys. With that, I know we've been on for just over an hour. I want to let everyone go and enjoy their evenings. I appreciate everyone who's attended this evening as well. We will leave the chat open a little bit longer if you haven't got your name and email out there. If you are working with an admissions rep already, just please continue to work with that advisor. And yeah, we hope that we gave you all the information you need. Of course, you can always reach back out to us and we can continue this conversation at another time. But for now, we'd like to thank you all for coming out and enjoy your evening.